Chris Ryle is a 4-year-old little boy. He has extensive decay on tooth 7-5. It was suggested to him that he have a pulpotomy done and a stainless steel crown placed to preserve the space. Chris is out watching Toy Story while Mr. Cody Ryle is in on Chris's behalf discussing the stainless steel crown.
Hello, Mr. Ryle.
Mr. Chris's appointment?
Yes.
How are you?
Good, thank you.
Good.
Okay. So, how are you today? Is Chris outside?
Yeah, Chris is outside. He was watching some Toy Story movie. I don't know, you can't get the kid away from him. How are you?
Good, thank you. So today we're going to talk about stainless steel crowns.
Yeah, and Chris hasn't really had any of this kind of sort of decay. I'm not really 100% sure on what this even is. Can you explain it?
Not a problem. I'm going to give you a whole bunch of information at the end to take home so you can talk to your wife about it.
Perfect.
But right now, I'll tell you about the stainless steel crowns is a thin aluminum crown made from medium hard metal, so it's durable. They're used on teeth with essential to match it, so it's not essential to match the decay.
Oh, I understand, but this seems like a lot of money. Is my insurance covering this, or am I going to have to go into his piggy bank?
I understand that money is always a factor, Mr. Ryle. For your son's tooth repair, the pulpotomy would cost $97, and for the stainless steel crown, it would be roughly like $253. For the stainless steel crown placement. Now, sir, most of it is covered by insurance, depending on your insurance plan. However, you might want to check up with Krista at the front, and we can see that, and she'll send out a payment, and it'll be sent right to you.
Oh boy, this guy is sure costing me some money, so I'm definitely going to have to break into his bank.
Now, sir, there are many advantages to this procedure. It is relatively cheap in cost. It's much less expensive than your other options. It can be prepared and placed in a single appointment, which is good because I know Chris has a busy schedule. And the crown is durable and lasts until the primary teeth shed.
Oh, okay. But you explained all these advantages to me. What are the disadvantages? Like, I'm sure there's got to be some, right?
Mm-hmm. So, stainless steel crowns are not very aesthetically pleasing because they're stainless steel. So that's one disadvantage. There's also a chance of recurring cavities around the actual tooth. So we would just have to make sure that he cleans it very well, and we'll give you special tools to do that. He could lose the tooth soon anyhow, so it doesn't matter. And his gums might be inflamed after the placement, but it'll subside after a while. There's also factors that could affect the success of the stainless steel crown, and which would be poor tooth preparation, poor crown retention, which we would all take care of, so it doesn't really have anything to do with you. Poor cementation, and lastly, the crown could wear on the surface if there's grinding. But since it's primary, it probably wouldn't be that bad.
Okay, but he is only 4. He should be losing his teeth soon. Shouldn't you guys just yank up the tooth?
Well, sir, that's an option. However, that leads to the rest of Chris's teeth to shift. So some other options would be you could extract it, and then put in a space maintainer, which is a little bit more expensive, until the permanent tooth starts to erupt. However, the extraction will hurt him a lot more than this procedure would, and it might not be ideal for him because he's younger and we don't want to make him scared of the dentist. He can also have a pre-veneer stainless steel crown, which provides coverage and is easy to place and aesthetically pleasing. However, those are more costly. And I also know aesthetically unpleasing, but that's okay because it's in his posterior.
Well, as you know, Chris has a really busy schedule with soccer and baseball and tennis and all those fun sports. How long does this procedure usually take? Like, our timetables are really crushed in.
I know Chris is quite an active fella. However, it's not to worry. It'll only take one appointment, and it'll be about 45 minutes long. So that's not too long. And it just depends on Chris. He's an active fella, but that's not to worry. The procedure will only take one appointment, and it'll be about 45 minutes long. But that depends on Chris's tolerance and if he's antsy or not. Now I want to show you a short slideshow to show you what I would be doing.
Okay, thank you.
The placement of the stainless steel crown. First of all, you will have to have a pulpotomy. This is when the tooth is initially prepared by removing the pulp and filling it with a rubber material. Preparing the tooth. After the local anesthetic agent has been administered and has taken effect, cotton rolls or dental dam are placed to isolate the tooth. The dentist will then use a high-speed handpiece and a tapered diamond or carbide burr to prepare the tooth in a method similar to that used for a cast crown. The dentist will reduce the entire circumference of the tooth as well as the height of the tooth. All dental caries will be removed and the hand instruments with the hand instruments and burrs. Selecting and sizing the stainless steel crown. The crown is selected and then tried on the prepared tooth for fit. The crown is properly sized when it fits snugly on the prepared tooth and it has both mesial and distal contacts. Trimming and contouring the crown. The dentist will reduce the height of the crown until they are approximately the same height as that of the adjacent teeth. Trimming and contouring the crown. The dentist will reduce the height of the crown until it is approximately the same height as the adjacent teeth. The occlusion will be checked and adjusted as needed. The dentist will then adjust the margins of the crown to obtain the tight fit and proper cervical contour. Cementation. The dentist will rinse and dry the tooth thoroughly and place the cotton rolls to maintain dry conditions. The cement is mixed. Polycarboxylate is most often selected. The cement is then placed on the crown and seated on the tooth. Any excess cement will be removed. The final check. Once the crown is seated, the dentist will do a final check to make sure the crown is fitted properly. Follow-up appointment. The dentist will check for the occlusion and fit and seating. The gingival margins condition around the crown is also to be checked at that appointment.
Oh wow, so this PowerPoint really explains a lot to me. I know, will Chris be in any pain during this?
Not to worry, the procedure will have some freezing during it, so he won't feel any pain then. After, he might feel some discomfort just because of the tissue irritation, so you have to make sure that you'll look at it, and if anything is abnormal, you can call us and we'll take him back. We'll also have a post-care, so we'll check him out then. Also, you have to be cautious of your child until the anesthetic wears off, just because he might be a little loopy.
No problem, I understand. Okay, and I know you said earlier about how you have a pamphlet for me. Do you have that on you right now?
Yeah, I'll give you everything in the envelope right here.
Perfect, thank you. So do I just go make an appointment with Krista?
Yeah, you can go up to the front and make an appointment with Krista.
Perfect, well thank you for your time, and I'll see you soon with Chris.